There's something special going on at Tameside and Glossop Primary Care Trust. A practice in Hyde is the only doctor's surgery in the world that gives patients full access to their medical records, and it's all totally secure. The thinking behind giving such access to medical records is to give patients confidence in the service their doctors provide. Gary Cottrell is there for us now.
Of course, everyone in the NHS uses their head and their heart to help patients, but we're here in Tameside and Glossop concentrating in a way on fingers and feet. More on the feet later, but first fingers, and how some patients in Hyde can use their fingers to access their medical records online. Yvonne Bennett is one of a very rare breed indeed. She's a patient at the only practice in the world to offer full access to medical records. The GP behind the system hopes it will go nationwide one day.
It's a new service that we're offering. It's free, it doesn't cost you anything, but it means that you've got access to your full medical record.
In 2000, Dr. Amir Hanan took over Harold Shipman's patient list and set about trying to rebuild their faith in the medical profession.
If patients had real-time access to the real record, then they could see exactly what's happened, what changes have happened, and that improves the safety profile for everybody.
It makes sense.
Later, in the comfort of home, Yvonne can use her own personal PIN code to see her own personal medical records. It's as secure as internet banking.
Having the ability to take control in your healthcare, your own healthcare, and sometimes you can just basically cut the doctor out, as it were. If you want to order repeat prescriptions online, you can do.
It's that final bit that's causing unease among some doctors. But this member of the Care Record Development Board believes such concerns are unfounded.
It appears on the surface to threaten the role of the medical expert whilst empowering the patient. In fact, my impression in the long term is that it's exactly the opposite. That basically the more the patient knows, the more the practitioner can do with the patient.
So now, as promised, to feet. Alan Milburn's feet, to be precise.
A godsend, really. You know, because the problem I had at the time, I wanted it seen to as quickly as possible, you know, so obviously I went to my GP, referred me to the clinic.
Happy because his peripheral vascular disease was diagnosed and treated very quickly without the need to see a consultant. In the past year, the Lower Limb Vascular Service has prevented over 300 needless delays for treatment by intercepting all referrals.
The wait times for our service are very, very low, so we're looking at a 2-week wait as opposed to over 10 weeks to go and see a vascular surgeon in the outpatient setting.
Mr. Milburn stopped smoking, started exercising and can now walk without pain. Another success story for the PCT, headed by this man who wants to oversee more changes for the better.
I see the role changing. I'm seeing it being more of an agency working on behalf of the local population and the practices, so that we can show that we're actually getting the services that people need and want, and we're able to do it in a way that's far more personable than ever before.
And that's more than just lip service. The fingers and feet prove that.